In the dynamic world of healthcare, a medical crisis becomes a decisive moment where swift, precise actions can tip the scales between recovery and heartbreak. Recognizing the critical nature of these events, where a patient's life or limb is at risk, is crucial for effective management. In these moments, urgency must be paired with accuracy, highlighting the vital role of crisis response. Frontline healthcare workers grapple with these demanding situations with expertise and poise. Medical crises arrive without warning, necessitating prompt responses and a series of critical decisions. Every second is precious, each decision creating waves of impact. The task of handling such emergencies is daunting, requiring both clinical acumen and the calm of experienced professionals. This video series dissects crisis management anatomy, arming caretakers with essential knowledge for effective intervention. Focusing on healthcare protocols and patient-centered care, we present strategies to protect lives during medical emergencies. Each new segment builds on this foundation, emphasizing that in crisis management, preparedness isn't just beneficial, it's essential. The ability to swiftly recognize medical emergencies can be life-saving. From the abrupt distress of a heart attack to the silent threat of a stroke, each crisis bears distinct early signals. To identify these, think of the body as a complex system with each part prone to acute failure, be it breathing difficulties, allergic reactions, or the crippling onset of sepsis. For healthcare providers, noting these early signs is a duty that requires a sharp mind amid chaos. The journey through crisis management starts here, with the identification of subtle symptoms and the vital role of vigilance. As we equip ourselves with the knowledge to detect these warnings, we ensure that each patient holds a chance for a brighter tomorrow. Let's enhance our understanding and acuity as we step into this critical phase of crisis recognition, preparing to take swift, definitive action. Crisis response in healthcare is a dance of precision, dependent on each member performing their role in harmony. Doctors lead with strategic decisions guided by patient data. Nurses navigate through the upheaval with a blend of skill and empathy, and paramedics bring their training to the fore with rapid, accurate interventions. This detailed choreography, governed by specific operating procedures, is the crux of a successful emergency response. Every healthcare professional, from pharmacists double-checking dosages to radiologists interpreting images, plays a part in ensuring effective patient care. This segment delves into how these roles unite under pressure to safeguard patients, and how strategic communication becomes the linchpin for maintaining order. Next, we will examine the direct implications of communication in crisis management, emphasizing its impact and the role it plays in patient safety. At the heart of every emergency, communication is the cornerstone that keeps the healthcare machine functioning. It is an essential part of patient safety and a critical component of crisis management. Clear and robust communication channels act as conduits, ensuring critical information reaches every member of the team. In the chaos of a crisis, the precision of information transfer is non-negotiable. Miscommunication can lead to preventable errors with severe consequences. Coordinated efforts across roles streamline operations, aligning every team member with the unified objective of patient care. As we advance, we highlight how communication creates clarity in practice. The forthcoming segment will explore the evaluation and management of healthcare resources, testing the effectiveness of our communication and crisis management techniques in ensuring patient safety. Confronting medical emergencies pits us against the relentless tide of time, making accurate prioritization our invaluable ally. Segueing into the prioritization of patient safety, we affirm a paramount principle: patient safety first. Triage systems exemplify this as healthcare professionals quickly determine the needs of each patient. With resources finite and demands pressing, their rapid decisions spearhead the efficient use of time and materials. This judicious deployment of resources reflects a well-oiled machine, each part critical to its harmonious function, whether it involves medication, equipment, or manpower. By understanding these core tenets of resource distribution, we grasp the magnitude of decision-making in crisis scenarios. We now look ahead to how resource readiness serves as the backbone of response in the subsequent phase, focusing on the element of preparedness in every healthcare environment. In the critical moments of a medical emergency, the readiness of resources parallels the expertise of medical professionals. Every piece of equipment, from defibrillators to ventilators, must operate flawlessly, and the availability of skilled staff is just as crucial. Effective management ensures these resources are available when needed most, converting meticulous planning into life-saving action. Beyond equipment and staff, we acknowledge the supply chain's pivotal role in supporting seamless care delivery. Its robustness is essential, for an interruption could mean the difference between success and failure. We proceed now to the vital practice of training and simulations, recognizing that continuous preparedness is a dynamic journey rather than a destination. Join us in the next exploration of how these rehearsals solidify crisis response capabilities. The infrastructure of crisis readiness is underpinned by regular training and simulation drills. These intense exercises sharpen our instincts for emergencies, embedding the principles of prompt and accurate response into our subsequent actions. Frequent and realistic simulations are proven to elevate team effectiveness when every moment counts. As we explore the essence of preparedness, we come to understand that repeated practice and coordination are the seeds from which resilience grows. Our final segment will wrap up the series, summarizing the key components of crisis management and highlighting the ongoing importance of learning and adaptation in the quest for professional excellence. We conclude our journey by weaving together the fundamental aspects of medical crisis management that have been outlined throughout this series. We have explored the steps from recognizing emergencies to responding adeptly, ensuring effective communication, prioritizing safety, managing resources efficiently, and embracing relentless training. These components form the mantra of any committed healthcare professional. Now, let this culmination be your call to action. Maintain an enduring commitment to learning and preparedness. Knowledge is the shield that guards against the unforeseen in medical emergencies. As you step beyond this instruction and back into patient care, let your resolve for crisis management excellence drive you, remembering that it can significantly impact lives. We thank you for your dedication to healthcare and urge you to continue strengthening the foundation of crisis resilience.